but lower than yesterday, and that's a good thing. The majority, 67 cases, are in HRM, and we're continuing to test, track, and trace the virus as we are across the whole province. There are 6 cases in CBRM. That's not a huge number, but it is concerning as the cases continue to climb there. That's why this province-wide shutdown is so critical. The measures we currently have in place are part of a broader strategy to slow the spread and reduce cases of COVID. We are limiting movement. We are testing at a record rate to detect the virus, and we are rolling out our vaccine. Today, I'm happy to announce that we're adding another cohort to our vaccine program. Appointments for AstraZeneca will be made to 40 to 54-year-olds in the coming days. We're hoping by Friday. These appointments will be open across the province, and anyone who wants to book one between those ages of 40 to 54 will be able to do so online. I know many of you have been asking for this and are anxious to get your shot, so we're pleased to be able to add this age group to our program. By the end of today, over 300,000 doses will be in the arms of Nova Scotians. Thank you to those administering the shots and to the tens of thousands already having the jab in their arms. I also want to thank Dr. Strang and his team, including Tracy Barbrick, for their tireless work in keeping this vaccine engine running. We are getting there. We have to continue to be positive and patient. I know it's hard to stay positive in the midst of the third wave and in the midst of a province-wide shutdown, but we need your help to slow the spread. And frontline healthcare workers need you too. They are exhausted. And now with schools closed, many could be facing childcare issues. We need to support them. We are very lucky in this province to have a wonderful childcare sector. People who have been supporting the frontline workers since the beginning of the pandemic. Whenever we have to shut down other businesses or schools, our childcare sector stays open to support our healthcare and essential service workers. And we are leaning on that sector once again. For the next 2 weeks with school closed, we are asking people who are working from home to give up their space if possible, to make room for the child or children of our frontline workers who can't work from home. The province will cover the cost and ensure after the shutdown is over and schools reopen, you will get your space back. I don't want those on the front lines of healthcare to have to worry about childcare. I don't want someone who gives up their space to worry that they won't get it back. And I don't want our childcare sector to worry. We'll do right by you. Our children are our future, and they are growing up in the midst of a pandemic in a very confusing time. We are grateful to our childcare workers who continue to support our frontline healthcare workers by taking care of your children when you are working so hard taking care of us. It's only the first day of this 2-week shutdown, but I have to say that I have confidence in all of you that we can get through this by working together. Over to you, Dr. Strang.
Thank you, Premier. Good afternoon, everybody. I, too, am pleased to see that our case numbers have gone down, but it is only one day. It's quite possible they may go back up again tomorrow. What we want and what we're looking for is a sustained downward trend. It's important to remember that the case numbers you see every day are people, not statistics. They are Nova Scotians who need our compassion and kindness because they are ill. Today we have 11 people in hospital and 4 are in the intensive care units. Yesterday, New Brunswick announced that someone in their 20s died of COVID. The variants are quick and strong. We cannot see our numbers increase. So we must carefully follow the restrictions that came into effect this morning, get tested, and watch for symptoms. We also have to be thoughtful about our personal activities, and I'd like to talk about a few of the key restrictions that we're getting a lot of questions about. The first is gathering limits. For the next 2 weeks, you can only gather with your household. Your household is the people you live with, but if your household is small with 1 or 2 people, you can socialize with 1 or 2 others, but they must be the same people over this 2-week period. We're asking you to limit your contacts and not gather indoors or outdoors with anyone outside of your household. I've heard from parents with children who are having a hard time understanding this. They want to play outside with their friends. If I can talk to all the kids out there giving mom or dad a hard time, we need you too to be careful for a little while so you don't get sick or make anyone else sick. You're as important as everybody else in Nova Scotia, and we need you also to be keeping each other COVID safe. There are some things that you can do with your friends that are safe and will keep you 6 feet apart, like a bike ride, a game of tennis, or a walk, even a FaceTime call, but you cannot hang out together in your house and play video games. The second item I want to talk about is travel. People love to look for loopholes around our travel recommendations and restrictions. We ask people just to please stop trying to find a loophole, do the right thing, and don't look for a way around the rules. So stay close to home for the next 2 weeks. Yesterday, the Premier said that legally your community is your municipality, and that is true. But we're asking you to define it even more narrowly, especially in suburban and urban areas. Get your groceries, medications, and gas as close to home as possible. Go to parks and trails as close to home as possible. Don't go across into another municipality, don't go across the municipality just because you can. So if you live in my community of Fall River, stay within the Fall River community as much as possible, and no non-essential travel outside of that community. I know people are looking forward to camping or going to the cottage, and hopefully you will be able to do that soon. But right now and for at least the next 2 weeks, if your cottage or the campground is not in your community, you cannot go. The third piece on restrictions that I'd like to talk about is retail and shopping. Again, we've had many questions about what stores and services can be open. Retail stores are closed for in-person shopping unless the store primarily sells an essential product or products, such as food, medication, diapers, hardware essentials. There is a list of all essential product types on the government's coronavirus website. And today we are adding gardening supplies to that list in recognition of the time of year and the fact that we want people to be outside working in their gardens. That's good for us, it's good for our physical and our mental health. If your primary product is in the essential list of 11, like a grocery store or a corner store that sells food and gas, you can be open for in-person service at 25% capacity. And to the shoppers doing in-store shopping, I remind you that these stores will have protocols in place around masking and physical distancing that you will you'll need to continue to follow. If your primary product is not on the list of 11, like clothing or a furniture store, you cannot provide in-person service and will need to switch to virtual ordering with delivery or curbside or doorside pickup. There are no limitations on providing services as long as those services respect masking, distancing, and cleaning protocols. And by services, we mean things like banking, car repairs, or pet daycares, to name just a few. These can remain open. We're also not restricting people who can come into your home to provide necessary services like cleaning, home renovations, or appliance repair. But I would ask people to only use those if they are essential. And again, if people are coming in, it's important that all protocols of masking and hand washing and keeping distanced are followed to keep everyone safe. As I said yesterday, the goal of restrictions is to keep people at home as much as possible. COVID-19 loves crowds and social activities. We need to regain control over the virus, and this means not doing things you did yesterday or last week or last month. Thinking it doesn't matter because you're just one person. All of us are connected to each other. And all of us have a role to play, and the case numbers will not be reduced without all of our efforts. And I know the last 6 days have been hard for people. Our case numbers have quadrupled. We have brought in 3 sets of ever-increasing restrictions during the pandemic, and that has never happened before. If you're confused, that's okay. I'm having a hard time keeping track myself. If you're feeling uneasy or fearful, that is understandable and perfectly normal. and it's okay to talk about it. If you need mental health supports, they are there for you. Go to mha.nshealth.ca for who to call and other information. Please take care of yourself and others around you. If you know of someone who needs help, reach out. Maybe they are a neighbor, a business owner, or an employee of a business that is closed. If you know someone who lives alone and may be feeling isolated, reach out to them virtually or drop a meal off at their doorstep. Let them know that you're thinking about them. And to all of the students out there who are now living with restrictions and doing school online, I ask you to hang in there. The best thing to do is talk to your parents and friends about how you're feeling and try to stay in a routine. Get up, do your classes and homework, get some exercise and fresh air, talk to your friends on FaceTime. With the steps we took yesterday, you should soon be back in school for in-person learning. And I'll close with some thanks. I'd like to thank all the people who are diligently following the restrictions. Thank you to those who have gotten tested. Thank you to the members of the Army's 36th Canadian Brigade who are now helping in our testing sites. Thank you to the volunteers, healthcare, and other workers who are running testing sites, working in the lab, doing the public health work, and working at our vaccine clinics. This is a challenging time for Nova Scotians, and I'd like to end from a quote from Emma Donoghue. Scared is what you are feeling, brave is what you are doing. Tina.
Thanks, Dr. Strang. Just a reminder, we'll take one question and one follow-up from reporters on the phone in the allotted time that we have for today's briefing. We'll start with Alicia Drouse from Global. Go ahead, Alicia.
Thank you. Daycares operate similarly to schools, but daycares right now have no ability to physically distance the small children, and there's also limited ability to make them wear masks. So I'm just wondering what the province can do to protect early childhood educators right now, as daycare is obviously an important and essential service to keep open.
So, I mean, we've all along, we've had a number of protocols in daycares, starting with screening kids who are feeling unwell, not going, enhanced cleaning. We've strengthened the requirements around masking, acknowledging that especially younger kids, 2 to 4, may have challenges with wearing masking. And so we do have a provision in the public health order that if there are children who are between the ages of 2 and 4 and their caregiver is having challenges getting to the wear their mask, they are exempted from wearing a mask, but we encourage wherever possible the masks to be worn. So we'll continue to work, and if we have cases, then we do our usual follow-up, identify close contacts, work with the individual daycares. We recognize the challenges in daycares, but we've had good COVID protocols all along.
Go ahead, Alicia, with your follow-up.
Thank you, and this was for the Premier. Will the province consider danger pay or any kind of bonus for these essential workers, or advocating for one from the federal government, as it was able to provide to healthcare workers in Wave 1?
Well, certainly we would be advocating for supports for our childcare workers if there's an eligible federal program, and again, they're the ones standing up to enable us to keep our healthcare system strong. We really do need their support during these challenging times, but we have the right protocols in place. When there are issues at childcare centres, there is a process to be followed, and if they need to be closed, they will be. But with people staying home more and more, that we're making sure that we're doing everything we can to prevent any cases entering into these childcare centres, and they stayed open in other jurisdictions with other types of circuit breaker approaches. And again, I want to thank those workers who are doing everything they can to support us as a whole.
Next, we'll go to Blair Rhodes from CBC. Go ahead, Blair.
Thank you. My question is for Dr. Strang. You just lowered the eligibility for the AstraZeneca vaccine. I'm wondering, we're hearing anecdotally that there are stockpiles of the vaccine, that people are reluctant to take that up, specifically because of all the negative publicity associated with blood clots and the like. Are you hearing anything similar, and are there any measures you might consider taking to try and get more uptake of that particular vaccine?
So I'll answer. I was just handing a note. I was made an error in my remarks. We have 3 people in the ICU, not 4. So my apologies for that misinformation. So with the AstraZeneca vaccine, we recognize that there's a lot of information out there. What we're in the process of doing, and will be in place when we open this up on Friday, is making sure people have clear information about the risks and benefit of the vaccine, and also when they might be able to get mRNA vaccine if that's their choice. Ultimately, we want people to have clear information and make it so they can make an informed choice about what type of vaccine they would get when they will get it.
Go ahead, Blair, with your follow-up.
But are you seeing hesitancy specifically on this vaccine because of the fears associated with the blood clotting? And basically, are there supplies of this vaccine that are going begging for patients?
We've certainly seen a lot of appointments being canceled, and that's one of the reasons we're opening this up again with informed consent. There are people out there asking for the vaccine, but so yeah, there people are making choices. They also know as we opened up to the 55 to 59-year-old group with the mRNA vaccine, that also people have the ability to make that choice immediately about which vaccine they'll choose. So yes, there is vaccine out there. We're going to open it up and give Nova Scotians the right information so they can make an informed choice.
Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Good afternoon, Dr. Strang. I'm just wondering if you can give us any more details today on what the military is actually doing and whether that's helping you to free up other people to support elsewhere in the public health system.
So they're taking on a number of roles. I can't say specifically, some of the non-clinical roles, but I think some of them are even being trained as testers as well in our primary assessment centers. It's not freeing up people. What it's doing is adding another group of people. So we continue. We've built significantly increased our capacity in those primary assessment centers. We need to sustain that capacity at least for a short period of time. So we need additional people. So people need some rest as well. So that additional capacity is going to help us sustain the increased numbers that we can swab on a daily basis through our PACs.
Just to add some detail to that, so there's now actually 74 armed force members, and my understanding is they're across the province in testing centers: Halifax, Dartmouth, Wolfville, Truro, Yarmouth, and Membertou. So thanks again to the federal government for arranging for that.
Go ahead, Keith, with your follow-up.
Yes, and in regards to the single case identified at Northwood, my understanding from talking to people there is that they're now working with public health to develop some kind of testing strategy going forward for all of the residents. Do you have any details about exactly what steps will be undertaken there in order to be assured that everyone's safe?
No, beyond what you just said, I'm not in the weeds and the details. We know we're going to be testing residents and staff, but what I was reassured yesterday when I saw that both in staff and residents, there's been a very high uptake of the vaccine. And as I've said several times in the last few days, I have the least anxiety around long-term care facilities, simply because we know the residents are well protected with vaccine, and everywhere across the country where we have seen in this third wave, we've seen a great reduction on the impact on long-term care facilities from vaccination, and even when there have been cases, there's been relatively minor spread, and where there has been illness, has been very mild illness. Our seniors in long-term care are well protected by our vaccine strategy.
Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Thank you. Dr. Strang, can you talk at all about how many appointments are being canceled? We're hearing, obviously, there are a number of people who were originally booked to get AstraZeneca. Now that the age cohort was lowered this week, they're switching to book Pfizer or Moderna. Pharmacies say there's between 1,000 and 2,000 doses they have sitting in fridges. How many appointments are actually being canceled?
So it's fluctuating. I talked to the vaccine team earlier today. There are people that are canceling their AstraZeneca, looking to see when they might be able to get an mRNA vaccine, and then some of them may be coming back because they want to get it'll take longer to get an mRNA, so they're coming back and booking AstraZeneca. So there's a lot of fluidity. It's in the range, what I was told, is about 10,000 doses out there that we will then be able to use that to open up those appointments for starting Friday. More details to come on the younger age group.
Go ahead, Natasha, with your follow-up.
Thank you. Just in relation to the case at Northwood, I understand more than 90% of the residents and more than 80% of the staff at that Northwood campus have been vaccinated. Do we know if the individual who tested positive for COVID last night did receive their 2 doses of vaccine?
That's personal health information that we can't disclose for the privacy reasons.
Next, we'll go to Andrea Blanc, Radio Canada. Go ahead, Andrea.
Hello, my first question is for Premier Rankin. We talked to a representative of small businesses who said that the help from government is not enough and other programs were promised. So what will the government do better to support the businesses at least for 2 weeks and moving forward?
Yeah, what I would just ask is for some time for our department to get some information together. This is broader than the Halifax area, so it's going to take more time than we originally thought when we shut down in Halifax. And I know they're working around the clock to get the right information, and they're in touch with the associations that represent different industry groups. So we're looking at the Small Business Impact Grant to start, so that might be the program they're referencing, but we'll make sure that we do have support in place. And again, there's a lot of federal programs that are still working right now.
Go ahead, Andrea, with your follow-up.
Some people are questioning why fully closed many businesses that are deemed non-essential, or even public places like rec centers, who we know are good for mental health and physical health. Could you explain why it was important to fully close these kinds of public places? Thank you.
So those are places, we know the virus thrives when we bring people together, whether it's in workplaces, in social places. The reality is often workplaces are because we have more, we can establish strong COVID protocols. So it's often when you bring people together for recreational social reasons that create the highest risk. We have too much local spread in the Halifax area to tolerate, and there's too much risk of bringing people together. So even for a recreational event, for sports, for arts performance, or even a rehearsal, people going to the gym together, we need to take a short, sharp shutdown of all those things. We need people to stay home as much as possible, only going out doing essential things. I get it. You know, people. It's important that people are physically active for their physical and mental health. We have a great outdoors. Get out and walk. The simplest way to get exercise is to go out and walk with your family, as you're allowed to within your household. We encourage people to do that in their community. But right now, it's too risky to have people congregating in gyms or all the other centers you talked about. This is a short-term, strict measure to bring the virus under control. I recognize the challenges, but it's absolutely necessary.
Next, we'll go to Nabal Snan from the Chronicle Herald. Go ahead, Nabal.
Good afternoon. Dr. Strang, I understand that the province is working on increasing vaccination rates among long-term care staff. Can you tell us what is needed in terms of logistics to speed up that process?
So it's not a matter of speeding it up. We're working by facility to understand what the vaccination rate of their staff is, and then working with them to say what can we do to support them to increase the vaccination rate of those staff. Often it's helping first and foremost, them understanding each facility how many of their staff are actually immunized, because they may have many staff who went out in the community and their employer is not aware of it. So we're asking all long-term care facilities to work with all their staff to know first and foremost what is the vaccine uptake rate in that facility, and then we will work with them when necessary of how to improve that. And very often it's as simply as giving more information and pointing them, the unvaccinated staff, making sure they're aware of how they can get access at one of our vaccination clinics.
Go ahead with your follow-up, Nabal.
Thank you for that. Dr. Strang, you also asked people to rebook their vaccine appointments if they've tested positive, of course, or if they've been told to self-isolate, or if they have symptoms. How concerned are you that appointment cancellation for that reason could affect our rollout?
We're watching that very carefully. What we do in all of our clinics, we have a process that that if they're getting towards the end of the day and there's appointments that have been canceled on short notice, we're always finding other ways to make sure we use that vaccine. The reality is, though, if people are sick and and they're booking their appointment for whether it's next week or the week after, we have lots of time to then reopen that slot and somebody else can then get it. So we have things in place, but I'm confident that there's enough demand for a vaccine that if some Nova Scotians have to rebook, other Nova Scotians will be very ready to take that appointment.
Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
Thank you. Premier, Ontario is trying to top up the Canada Recovery Sickness Benefit from $500 to $1,000 with provincial money. Would your government support this program and commit money to it? And if not, will any kind of sick benefit be coming to the province?
We're always looking at best practices across the country and how they're supplementing what's been made available from the federal government, and we can consider that for sure.
Go ahead, Lindsay, with your follow-up.
Thank you. Premier, I'm also hoping you can tell us more about the child care for essential workers. I'm wondering if this is going to be funded partially, or is this just programming to reallocate spaces for people who need them and will be asked to pay out of pocket. I know that I've heard from essential workers who are concerned about the cost of childcare with their kids out of school while they have to work.
So we'll get the details out if they're not out already. I believe we're working on that between today and tomorrow. But the idea is that we would support the cost of essential worker childcare.
Next, we'll go to Greg Mercer from the Globe and Mail. Go ahead, Greg.
Thank you. My first question is for Dr. Strang, and I want to ask about self-isolation requirements for travelers. And I'm wondering how much of this current outbreak you believe is linked in the early stages to people who did not follow the rules.
So ultimately, we know that the virus came in here from travelers. Some travelers, that are allowed to have modified quarantine, but most travelers have to quarantine. And yes, we've had some examples, but I don't want to focus just on those individuals because we know that some of our initially in the early stages, there were Nova Scotians here who made choices to socialize and get together with those travelers. So that we also have to, the point I always make on that is that let's not blame somebody else. What are the things that we have done and what are the things that we can do to make sure we are keeping ourselves and everybody else around us safe from COVID? So it's less about blaming and more about making sure we're doing everything we can do. And if everybody's focused on ourselves, together we will all keep each other safe.
Go ahead with your follow-up, Greg.
My follow-up is for the Premier Rankin. New Brunswick recently changed the rules for travelers, and they now require everyone entering the province to go to a designated quarantine hotel. I'm wondering if Nova Scotia has considered this or if it's on the table as you fight this third wave.
Yeah, every province is doing the border restrictions a little bit different. We've shut down our border entirely from travel coming into our province unless it's essential. And then we have some strict parameters around our rotational workers where they have to get tested and they have to have that negative test before they're out of self-isolation. So the first period of time that are in isolation, they're even away from their families. So we do have pretty strict parameters in place. We don't have any international travel that's not necessary, and we have real strict protocol around temporary foreign workers too. So we're able to trace the positive tests quickly, and again, our border restrictions have never been stricter as it is right now.
Next, we'll go to Jake Boudreau from the Port Hawkesbury Reporter. Go ahead, Jake.
Yes, my question is for Dr. Strang. I'm talking about the case at Sarek. The facility also houses the Strait Area Pool, and nearby are the offices of the Great Regional Center for Education. Are there plans to get people who work or visit those locations tested as well, or reach out to them for isolation, or are they just not considered close contacts?
So there would be, I'm not deeply immersed in the details of any individual cases, but our routine is always that if we have a case, we first of all work to identify who the close contacts of that case were. And if we can identify those close contacts directly, then we don't need to do a public notification. But if there has been a public exposure and the only way to get a hold of people, we'll do a public notification. We've modified that somewhat in the Halifax area because there's just such widespread, but certainly in Port Hawkesbury there would be or any other areas outside of Halifax, if there is the need to do a public notification, even with a low risk exposure, we'll put that information out.
Go ahead, Jake, with your follow-up.
My next question, a reader just reached out to me asking about the requirement to isolate for those living in the same household as a close contact. Does that depend on whether or not they're an essential worker? And if someone has been out and about, to a business or something, and they're in the same household as a close contact with the Sarah case, should others be tested or concerned as well?
Yeah, I can. So if people are, being identified as a contact, they need to isolate at home, which means that they have to be separated from the rest of the household, an individual bedroom. There can be a shared bathroom, but with cleaning protocols, we have the information online. And, they have meals at the door, those kind of things. If that's not possible, then public health will be aware of these people who are in close contact, and we have support. Housing and income supports, if necessary, for families to allow people to quarantine as appropriate.
Next, we'll go to Chelsea Gould from the Truro Daily News. Go ahead, Chelsea.
Hello, Dr. Strang. I'm hearing from the first responders still waiting for the vaccine. Will first responders be contacted by public health to get their COVID vaccinations, or do they have to wait until their age group is eligible?
So we've already immunized all our paramedics, emergency first responders who are volunteer firefighters who do advanced healthcare response. We're in the process right now of having clinics across the province for our police officers. So we're actively in the process. If most first responders will already have had their first dose, and we're actively immunizing police officers as well.
Go ahead, Chelsea, with your follow-up.
Thank you. Can you elaborate a little bit more about what progress you're seeing in vaccinating people within phase 1 and 2 across the province?
So we've looked at this today. So we're in like most provinces, we're right in around 25% of our overall population being immunized. Virtually all provinces are very close together, and we're each within 1 week or so of another of our kind of pace. But what I'm very pleased at, if you look at the speed of immunizing and the percentage of population that we're adding to our overall number in the last couple of weeks, Nova Scotia is #1. We have the fastest rate of growth in a percentage of percentage of population that we're immunizing ahead of every other province.
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Hi, I have a question about self-isolation. For people who have been at exposure sites, do they, their household members also have to self-isolate?
If they're able to isolate away, they do not. But and it depends on the level of exposure as well. If it's a low risk exposure, people just need to go get tested and don't have to isolate. If it's a moderate exposure, they have to isolate until they get their negative test result back. And high risk exposures, they have to isolate for that 14 days. As I said to the previous question, people need to do that in a household away from everybody else. If that's not possible, then the whole household may have to then go under isolation. They will be directed on this because they're high risk exposures by public health, or they may have to then make a choice to go somewhere else. So they're not doing their isolation with their family. And as I said, public health, these high risk exposures, the ones that we're involved in directly, we have the ability, and we have teams that look at how do we, where necessary, supporting individuals or families around housing and income if necessary, so they can maintain their quarantine.
Go ahead, Tim, with your follow-up.
Yes, Dr. Strang, I've been told that some people, travelers in particular, who have tested positive for COVID have been told that they're allowed to walk around in the community for an hour a day. Is that the case?
If people are isolating, we have said that they can go out for their physical and mental health benefits for up to 1 hour a day, go out alone, staying within close range of where they're staying to walk, run. They're not to be traveling around in a taxi or bus or anything. And if they're in like say they're staying in a hotel or in an apartment, they have to make sure they're masked, that they're getting outside without coming into close contact with anybody else. Recognizing that a 14-day quarantine can put significant strains on people, so we're allowing them to have that for their physical and mental health, but in a very controlled manner.
Next, we'll go to Victoria Walton from the Coast. Go ahead, Victoria.
Thanks. I'm wondering if you can just give a wider update about child care. I'm hearing from some parents who their child care provider is asking them still to pay a fee. I mean, of course, in normal times, paying that fee if you're not sending your kid is common, but I'm wondering right now what the situation is and if that information that was sent out yesterday, I believe, to child care providers is available for everyone online anywhere.
Well, that's a business arrangement. Many of our child care centers are private businesses that they have a certain arrangement with their customers, and if they have a certain obligation to pay for a certain period of time for child care, then the parent would be of course expected to pay for that. What we're asking though is if parents are at home and they don't have to leave their house, if they're able to stay at home with their children, that could lead to more open space and capacity in our sector that will allow us for help for our essential services to put their children in those centers, and the government would support that cost.
Go ahead, Victoria, with your follow-up.
Gotcha. Thank you for that. And Premier, this one is for you as well. I'm wondering about industries that aren't considered essential, but that are refusing to close. People working in these industries, I've heard of everyone working as car salespeople to the window and door manufacturers, and I'm just wondering what's the best situation for people to either report their employer or refuse to work in that situation.
So in the scenario where they're reported closed, maybe I'll get Dr. Strain to comment on that.
So first of all these employers, we've worked extensively over the last year through colleagues in the Department of Labor and Advanced Education, Occupational Health and Safety Division. All big kind of business sectors have robust, COVID plans when they reopened, or if they even didn't close during the first wave, we worked with them to make sure they have COVID safety plans. So businesses of a whole range and workplaces should have COVID safety plans in place that maximize the safety within the workplace. If employees are concerned about the safety, then we have the occupational health and safety process, and ultimately there is if people go on the government website and look on there's a 1-800 number for occupational health and safety concerns to be registered with government. We have a range of inspectors who will follow up with those concerns.
Next, we'll go to Carolyn Ray from CBC. Go ahead, Carolyn.
Hi there. I'm wondering if you can give us an update on our supply of rapid tests, and I'm wondering, are there any discussions to get more from other provinces that haven't been using them?
I don't have the exact number, but we just looked at this, and we've actually just ordered in the last day or two another supply of the rapid kits from the federal government, making sure we have an adequate supply. We're using a lot of them, but the federal government has a big stockpile of rapid test kits, so we have a robust process to make sure that we're able to access those federal test kits to keep our supply at the right level.
We have time for one more question. Go ahead with your follow-up, Carolyn.
I just wondered, Dr. Strang, if you can elaborate a bit more on why you're opening up AstraZeneca to such a large age group at once.
Well, simply because we know that there's our experience with this with the narrow age groups was about 25% of that age group would take the vaccine. So we want to open it up with the numbers balancing off what our expected amount of vaccine we might have available, and make sure people will have an opportunity if they choose for AstraZeneca to get that.
That's all the time we have for questions. Go ahead, Premier.
Thank you. It was a nice day today, and I hope many of you were able to get outdoors. Thank you for staying close to home and not gathering. Thank you to our teachers who have had to go back to e-learning, to our parents who have to support their children at home with their studying, and to those willing to give up a daycare spot for the next 2 weeks while schools are closed to help a frontline worker. And thank you to students who may be missing their peers and friends at school. I know it's not easy, and I'm sorry. To our senior population, our grandmas and grandpas who love to get visits, I'm sorry this has been so tough, but we want to keep you safe. Thank you for understanding what is hard to comprehend. Thank you to businesses who yet again are forced to close to insert in-person service. Let's do our best to support the online services and buy local. I want to thank the members of the Muslim community who aren't able to get together to celebrate Ramadan. To those who have had to cancel plans or celebrations on their own. And to all the mothers out there who will still be celebrated this year, but not in any large gatherings. These next 2 weeks will be difficult, no question. We're all fed up with COVID, but we are so close. We continue to do testing, and we will continue to vaccinate. We need all of you to stay close to home and to stay ahead of this virus. We can do this. We did it before. We did it by supporting one another, respecting one another, and being kind. I have faith in all of you that we can do it again.